Many men over 40 experience changes in their urinary health. This video explores a common condition affecting millions of men. Essential knowledge is provided to help identify potential issues early. Understanding these changes significantly impacts long-term well-being. The prostate is a small gland found exclusively in men. It is situated directly beneath the bladder. The prostate gland encircles the urethra. The urethra is the tube responsible for carrying urine out of the body. Its primary function is to produce seminal fluid. Seminal fluid is a crucial component of semen. Benign prostatic hyperplasia, BPH, is the medical term for prostate enlargement. This condition occurs when cells within the prostate gland begin to multiply abnormally. The proliferation of these cells leads to an increase in the overall size of the prostate gland. As the prostate gland swells, it exerts pressure on the surrounding urethra. The urethra is the tube that carries urine from the bladder out of the body. This compression of the urethra can result in various uncomfortable urinary symptoms. Benign prostatic hyperplasia, BPH, involves an enlargement of the prostate gland. The precise cause of BPH is not fully understood by medical science. However, it is primarily associated with the natural process of aging in men. Hormonal changes play a significant role in the development of BPH. Shifts in testosterone and estrogen levels influence prostate cell growth. Dihydrotestosterone, DHT, is a potent male hormone derived from testosterone. It plays a significant role in the development and growth of the prostate gland. DHT exerts its effects by binding to androgen receptors within prostate cells. High levels of DHT within the prostate are associated with increased cellular activity. This hormonal stimulation promotes the proliferation of prostate cells. Consequently, elevated DHT levels contribute to the enlargement of the prostate gland over time. Cellular changes within the prostate are a common and natural process associated with aging in men. These microscopic alterations accumulate over time within the prostate gland. The accumulation of these changes can lead to a macroscopic enlargement of the gland. This enlargement can impact the prostate's normal function and affect surrounding anatomical structures. Benign prostatic hyperplasia, BPH, is a common condition affecting the prostate gland. Genetic factors play a significant role in an individual's susceptibility to developing BPH. A family history of BPH can significantly elevate an individual's risk. This suggests a clear genetic component influencing the onset and progression of the condition. Individuals with close male relatives who experienced prostate enlargement are more predisposed. Obesity is a significant health concern linked to various medical conditions. Certain lifestyle factors, particularly a lack of physical activity, contribute to health risks. These factors, including obesity, are associated with an increased risk of benign prostatic hyperplasia, BPH. BPH is a common condition involving the enlargement of the prostate gland. Maintaining a healthy weight is crucial in mitigating these health risks. Adopting an active lifestyle can further help reduce the likelihood of developing BPH. Prostatic enlargement, often associated with BPH, is a common condition in men. As the prostate gland grows, it exerts pressure on the surrounding urethra. This compression narrows the urethral pathway, impeding the flow of urine. The resulting obstruction causes various urinary symptoms, making urination difficult. A common early symptom of prostate issues is an increased need to urinate. This symptom is particularly noticeable during nighttime hours. Frequent nighttime urination is medically termed nocturia. Nocturia can significantly disrupt an individual's sleep patterns. This symptom often indicates an underlying problem with the prostate gland. Benign prostatic hyperplasia, BPH, commonly affects men, leading to various urinary symptoms. One prominent symptom of BPH is a weak or slow urinary stream. This occurs due to the enlargement of the prostate gland. The enlarged prostate creates an obstruction in the urethra. This obstruction reduces the force with which urine can exit the bladder. Consequently, urination becomes less efficient and more difficult for affected individuals. Hesitancy refers to the difficulty or delay in initiating the urine stream. This condition is a key indicator of potential urinary tract issues. Despite a strong urge to urinate, individuals experience a delay before flow begins. Significant effort may be required to start the urination process. Intermittent urinary flow is characterized by a start and stop pattern during a single voiding session. This symptom indicates an inconsistent pressure from the bladder. The bladder struggles to push urine past an obstruction, often an enlarged prostate. This irregular flow is a key indicator of underlying urinary tract issues. Incomplete bladder emptying is a common urinary symptom. It manifests as a persistent sensation that the bladder has not been fully emptied after urination. This feeling is caused by residual urine remaining in the bladder. The presence of residual urine is typically due to an underlying obstruction. Post-void dribbling describes the involuntary leakage of urine drops after urination appears complete. This phenomenon occurs when residual urine remains within the urethra following the main bladder emptying. The urethra, a tube that carries urine from the bladder out of the body, can retain small amounts of fluid. After the main flow, muscle relaxation or anatomical factors can cause this retained urine to slowly escape. It is a common condition affecting both men and women, though more prevalent in men due to urethral length. Understanding the mechanism helps in identifying potential management strategies for this issue. An urgent and sudden need to urinate is a common symptom. This sensation is often difficult to postpone or delay. It indicates a strong, immediate physiological demand for bladder emptying. This urgency is frequently caused by an underlying obstruction in the urinary tract. The bladder compensates for this obstruction by contracting more forcefully. These increased contractions lead to the intense and sudden urge to urinate. Some men may experience pain or discomfort during urination. Though it is less common, this sensation can manifest as a general feeling of pressure in the lower abdomen. Such symptoms are not typical and warrant attention. They can indicate underlying complications within the urinary tract system. These issues may require medical evaluation to identify and address the cause. Maintaining a healthy weight is crucial for overall well-being and disease prevention. A balanced diet plays a significant role in weight management and hormonal regulation. Regular physical exercise is equally important for maintaining a healthy weight. Together, diet and exercise help manage hormone levels within the body. This management of hormone levels can reduce the risk of BPH progression. A diet rich in fruits and vegetables is particularly beneficial for this purpose. Managing urinary symptoms often involves careful consideration of fluid intake and beverage choices. Moderate fluid intake is generally recommended to maintain proper hydration without exacerbating symptoms. Avoiding excessive fluid consumption, particularly before bedtime, can significantly reduce nighttime urination. Certain substances, like caffeine, act as diuretics, increasing urine production and frequency. Similarly, alcohol is also a diuretic that can lead to increased urinary frequency and urgency. Limiting the intake of caffeinated and alcoholic beverages can therefore help in managing urinary symptoms. Regular medical checkups are essential for maintaining overall health and well-being. These checkups provide an opportunity for early detection of potential health issues. Discussions about specific health areas, such as urinary health, are crucial components. For men over 40, proactive engagement in these discussions is particularly important. Any changes in urinary health should be promptly communicated to a healthcare provider. Early communication facilitates timely diagnosis and effective management of conditions. Initial management of certain medical symptoms often begins with lifestyle modifications. These changes aim to alleviate discomfort and improve overall well-being without medication. If symptoms persist or worsen despite lifestyle adjustments, medical intervention becomes necessary. Pharmacological treatments may be prescribed to address the underlying physiological issues. One common approach involves medications designed to relax bladder muscles, reducing urgency. Another strategy includes drugs that shrink the prostate gland, easing urinary flow obstruction. For severe cases of prostatic obstruction where medication proves ineffective, surgical options are considered. These procedures are designed to alleviate symptoms caused by an enlarged prostate. The primary goal is to remove or reduce the obstructive prostate tissue. This intervention aims to restore normal urine flow, improving patient quality of life. Various surgical techniques exist, tailored to the individual patient's condition and needs. Minimally invasive treatments offer alternatives to traditional surgical procedures. These advanced techniques often result in significantly shorter recovery times for patients. They utilize methods such as heat, lasers, or other specialized technologies. The primary goal of these procedures is to effectively reduce prostate size. This video is intended solely for educational purposes and provides general information. It does not constitute a substitute for professional medical advice, diagnosis, or treatment. Viewers should not rely on this content for personal medical decisions or health guidance. Always seek the advice of a qualified healthcare professional for any medical concerns or conditions. Consult with your doctor or another qualified health provider regarding medical questions. Early awareness and timely intervention are crucial for effective prostate health management. Proactive steps can significantly impact long-term health outcomes and well-being. Subscribe for weekly health insights to stay informed and empowered. These insights provide vital information, supporting your personal health journey.